We are going to discuss the data management of patient registered at ART center and inventory and stock management. This is the part of the training manual for the ART center staff, and this is the module 30. By the end of this session, the participants will be able to maintain data of patient registered at ART center manually and through MIS. Will be able to analyze and report patients' data. Will be able to manage inventory and stock data manually and through LMIS. Will be able to understand different components of inventory management, including procurement, storage, and distribution. Will be able to calculate and forecast consumption of ARV drugs, diagnostics, and consumables. Will be able to develop indent request. Will be able to prevent stockouts, will be able to avoid any stock losses or expiry, will be able to write inventory report on monthly and quarterly basis. So what are the salient features of patient and inventory data management at ART center? ART staff is responsible for the management of data of patients and inventory. Data entry operator, that is DO, under the supervision of ART physicians, maintains the patient and inventory data. Medical record files, which are separate for adults and children, are filled and updated on each visit. All information from the patient file, adults, which are green in color, and pediatrics, which are blue in color, is then used to update ART register, which covers all daily inventory of supplies and consumption on that day. Data entry operator also dispenses ARV drugs and drugs used for opportunistic infections such as STIs, hepatitis B, hepatitis C, and tuberculosis. Each ART center also enters patients' data and inventory, stock data electronically in ART Management Information System, that is MIS. MIS is efficient data management system, and ART center physicians can see, analyze, and report registered patients and inventory data regularly. Data entry operator at ART center produces monthly reports including stock status and consumptions. Monthly consumption in stock report and indent request. The demand may include the following: ARVs for adults and pediatrics use, all diagnostics like combo, Unigold, SD Bioline, rapid HIV test kits, then CD4 kits, then viral load PCR kits where it is available, condoms and lubricants, STI medications, medications for opportunistic infections, IPT, the INH for preventive therapy, ATT if there is no TB clinic or referred clinic for TB drugs. Sample collection cups for gene expert test are also included in the demand. The inventory management cycle at the ART center. We have to forecast demand, then we have to order inventory, then we receive drugs, then we store drugs, then we distribute drugs, then we issue drugs, and then when they are consumed, we reorder drugs. So this is a very important cycle that goes on. What are the things to consider? We have to consider the stock on hand, stock consumed, buffer stock, projection trends, and lead time. Then we have to be very careful in forecasting. We have to strictly monitor the inventory. We have to be very careful about the physical condition of the drug received. We have to maintain these storage facilities. We have to go for the inventory control to prevent stock outs and stock losses. We have to submit daily and monthly reports, and then we have to be very, very careful in transportation of the drugs that we have received. So requirement estimation, quantity of the orders. Determining the quantities of the commodities to be ordered to meet demand and fill the pipeline to ensure continuous supply. The quantity of order must be adjusted for the quantity already in the system, that is stock on hand. The quantity is already ordered but not yet received. The quantity on order to meet the desired stock level. So what are the forecasting methodologies for the demand? The methodology selected for forecasting future demand for services and commodity needs is based on the availability and quality of data on the rate of consumption of drugs or commodities used, the number and type of patient receiving services, as well as on the program policies and expansion plans. Types of data may be used to guide the forecast. That includes the demographic data based on characteristics of the target population, morbidity data on prevalence or incidence of the disease or infection in the target population, the services statistics data on the number of service delivery sites, that is COPC sites or CBOs, logistic data on consumption, losses, and adjustment to inventory and stock in hand at the various levels of the in-country supply chain. Forecasting methodologies. The consumption-based methodology uses logistic data on consumption of the commodities in the past as the basis for projecting the future needs. Estimates of increase or other changes in consumption for each product during the period for the forecast are based on the past trends in consumption or product usage. Then the second is the adjusted consumption methodology. It is an adaptation of the consumption-based methodology that uses the consumption data of one facility with reliable data and extrapolates it for the need of to estimate the commodity needs for the other facilities. Then the other is the morbidity-based methodology. The estimation of the need is based on the application of the standard treatment guidelines, testing algorithms, or other treatment protocol to the projected number of the patient expected to receive the treatment or services within the forecast period. For logistic data and supply chain information, these are the steps. Obtain logistic data on ARV drug consumption, losses, and adjustments, and stock on hand if available. Calculate the wastage rate of ARV products caused by expiry, loss, or damage of the product. Without data, the rate is currently assumed to be 5% until data from the stock card becomes available. Determine whether an inventory control system is in place for the management of ARV drugs. Determine procurement lead time and supplier schedules and lead time for the delivery of the product. Determine established buffer stock levels or maximum and minimum inventory levels if available. Confirm facility orders intervals. Determine the frequency and timing of the drug procurement procedure. How to develop indent request? To develop indent request, need to have accurate forecasting of demand depends on stock on hand, consumption of the commodities in the past, quantity of the stock order, lead time, buffer stock, and projection trend. The DO responsible for inventory management compares manual stock register and computerized stock register. Depending on the stock on hand, consumption in the last 3 months, and projection trends, ART staff develop indent request. This demand is sent to the ART physician or the in charge of the center for review, approval, and sign, and then it is sent to the store in charge and then the logistic officer. A stock out or out of stock happens when the inventory is exhausted. The stockout can happen at any stage of the supply chain. Now, how to prevent stockouts? We have to have efficient inventory management system. We have to have an efficient inventory control system. We have to do the forecast of demand. We have to have the buffer stock. We have to have the physical count. We have to have good ordering practice. We have to order the fill rate. Logistic Management Information System LMIS should be adequately in place. How to prevent stock loss or expiry? It can be done by efficient storage management, store arrangement the principle of FIFO, first expiry, first out system. In case there is no expiry dates on the product, one should arrange the item according to the date of arrival using the FIFO method, first in and first out. Receiving the defective supply should be avoided, bin cards should be used, transfer of excess inventory should be done to the other centers, and adequate use of logistic management information system should be in practice. The key points to remember are that ART staff is responsible for the management of data of the patient registered at ART center and inventory management. Medical record files separate for adults and children are available at the ART center, and data of all registered patients is entered manually in the files and updated on each follow-up visits. Data entry operator also maintains the record of the stock of ARV drugs and other drugs for OIs, STI, hepatitis B and C and TB. He or she ensures that the center has enough stock of drugs for a specific period as per capacity of warehouse. He or she also informs and report to the ART physician when stock fall below the 3 months backup. Other points to remember are each ART center enters patient data and inventory and stock data electronically in HIV management information system on daily basis and checks to verify data to correct the discrepancy between the manually entered data, patient record file and MIS data. MIS is an efficient data management system, and ART center physician can see, analyze and report registered patients and inventory data regularly. Data entry operator at ART center produces monthly reports including stock status and consumption. For developing intent requests, there is need to have accurate forecasting of demand depending upon stock in hand, consumption of commodities, quantity in order, lead time, buffer stock, and projecting trends. Data entry operator must plan for buffer stock to prevent stockouts. Stockout can also occur at dispensing point as a result of uncertainties in patient uptake, changes in patient treatment regimens, and transport reliability. Inventory must be well labeled and arranged in accessible manner for counting and general management through the use of bin cards to make sure that drugs are in stock. ART staff must refuse to accept any defective supply where there is any doubt. However, any incidents during transportation in all such supplies must be reported to the higher management after proper documentation, including photographs of any doubtful supply. These are the references that can be accessed for the further clarification and for the further knowledge.